If you were to take a Venn diagram and draw like 3 separate circles,
Okay.
one for marine biology, one for radio frequency technology, and one for women's intimate health, you would probably just assume the center of that diagram is totally empty.
Right, yeah. I mean, on the surface, what could fish DNA and radio waves possibly have to do with treating menopausal symptoms?
Exactly. It sounds like the setup to, I don't know, a bizarre science fiction novel or something.
It really does. But that intersection actually exists, and it is completely grounded in some of the most cutting-edge regenerative medicine we have today.
Yeah.
We're looking at this space where those three seemingly unrelated fields kind of overlap
Mm.
to solve this profoundly common, yet, rarely discussed medical issue for women.
And that is exactly what we are focusing on in today's deep dive. We are exploring a really specific, rapidly emerging clinical question.
Right.
Can regenerative polynucleotides be effectively used on vulvar skin that has previously undergone fractional radiofrequency microneedling?
It's a very specific question, but a huge one.
Oh, massive. And to get to the bottom of this for you listening, we have a fascinating stack of sources today. We are pulling from peer-reviewed clinical journal articles, specialized medical spa treatment guides, and consensus reports from aesthetic medicine boards.
Yeah, it's a really rich mix of data we're looking at. We've got everything from the hard cellular biology, like how these tissues heal at a microscopic level, right down to the actual, clinical application guidelines for the practitioners doing this work.
Right. So the mission for this deep dive is clear. We are going to unpack exactly how these two distinct therapies, the mechanical and the biological, interact at a cellular level.
Mm-hmm.
And more importantly, we're going to look at why combining them is offering a groundbreaking, completely non-hormonal solution for intimate wellness.
Which is just huge for so many women.
Totally. Okay, let's unpack this. To really grasp how these treatments interact, we first kind of have to understand the mechanical foundation that's being laid in the tissue.
Right.
We have to look at the radiofrequency microneedling part first.
That is the perfect place to start. Because you can think of the microneedling as the mechanical catalyst.
Okay.
Because you really can't understand the biological fuel, which we will definitely get to, until you understand why the tissue is suddenly demanding that fuel in the first place.
Right, that makes sense. So if you are listening to this, you might already be familiar with traditional microneedling.
Yeah, it's everywhere now.
It's huge in the skincare world, mostly for the face, You're basically using a device with ultrafine needles to create thousands of these tiny controlled micro-injuries in the skin.
Exactly.
And the body interprets these physical punctures as damage, which triggers a natural wound healing cascade, right? It signals the body to send collagen and elastin to repair the area.
Right. It's essentially tricking the body into healing itself.
But our sources highlight a major upgrade here, which is radiofrequency or RF microneedling. How does adding radio waves change that basic mechanical process?
Well, it introduces a completely new, incredibly powerful variable, which is thermal energy.
Okay.
Right. In RF microneedling, the needles aren't just making physical punctures. Think of them as like tiny insulated conductive wires.
Oh, wow.
Yeah. So they penetrate the skin, and once they reach a really specific calculated depth in the dermis, they release a quick pulse of radio frequency energy.
So they're actually heating up down there.
Exactly. It generates this controlled heat deep within the tissue, far below the surface of the skin.
And our sources highlight specific devices engineered just for this, like the Morpheus 8V, I think it was.
Yes, Morpheus 8V is a big one.
I think it's important to note for you listening that this isn't just a facial tool being blindly repurposed for the rest of the body. It's specifically designed to safely deliver these thermal pulses into the deeper, more complex layers of vaginal and vulvar tissue.
That's a crucial distinction. It's highly specialized.
But what is that heat actually doing? Like, why do we want to heat up tissue beneath the surface?
It's all about how collagen reacts to temperature. When you heat up existing, older collagen fibers, which, they tend to get sort of sluggish and loose as we age,
Right.
the heat actually denatures them. It causes them to immediately contract and tighten up.
Like shrinking a sweater in the wash.
Kind of, yeah. It's a structural overhaul. You are thickening the mucosa, improving localized blood flow, and really strengthening that underlying tissue architecture.
Okay.
And clinically, that translates to improved elasticity and restored natural lubrication. And because the energy reaches the deeper layers, it can even help strengthen the pelvic floor muscles.
Wait, really? The muscles, too?
Yeah, which can alleviate things like mild stress urinary incontinence.
That's incredible. So it's sort of like aerating a lawn so the roots can grow deeper and stronger, but, with added heat.
That's a great way to think about it.
Okay, but I have to push back here for a second,
Yeah.
because if you're listening to this and wondering why on earth anyone would want tiny heated needles near such a sensitive area, you are not alone. I had the exact same thought.
Oh, I'm sure. It sounds intimidating.
We are talking about the vulvovaginal area. This is highly delicate, incredibly sensitive tissue. Doesn't adding deliberate heat and hundreds of needle punctures cause a massive amount of inflammation and pain?
Yeah.
I mean, it sounds intensely counterintuitive to injure tissue that might already be fragile.
You've hit on the exact paradox clinicians wrestle with, and it is a highly valid concern. You are absolutely right that we are causing deliberate thermal and mechanical injury.
Right.
And while that injury is strictly controlled by the practitioner, it absolutely does create an acute inflammatory healing response.
So there is downtime.
Yes, the patient will experience localized swelling, redness, and a period of tissue vulnerability. It is a trauma to the tissue.
So why do it? Like, why put the tissue through that?
Well, what's fascinating here is that this deliberate acute inflammation is exactly the biological mechanism that we want.
We want the inflammation.
Exactly. We are purposely waking up a sleepy immune system in that localized area. We're sort of forcing the body to pay attention to tissue it had started to neglect.
Oh, I see.
And that acute inflammation is what makes a secondary complementary treatment so incredibly beneficial to layer on top.
Ah, okay. Because we've intentionally triggered the tissue to work overtime, the body suddenly needs a massive amount of resources to complete the repair job.
Exactly.
Which brings us to the second part of this equation, the biological fuel. Enter polynucleotides, or PNs.
Yes. The RF microneedling has basically sounded the biological alarm.
Right.
The fibroblasts, which are the specific cells responsible for building new collagen and elastin, they're awake now. They are ready to work.
But they need supplies.
Right. They need the raw materials to actually build the new extracellular matrix. And that is where polynucleotides come in.
And here's where it gets really interesting because of where this fuel actually comes from. According to the sources, polynucleotides are highly purified DNA and RNA fragments, but they aren't synthetic. In the aesthetic and regenerative medicine world, they are primarily extracted from ethically sourced marine life, specifically the gonads of male salmon or trout. I mean, I have to stop and ask here, are we literally talking about rubbing purified fish sperm onto human vulvar tissue?
I know. It sounds completely wild when you say it out loud.
That really does.
But the science behind it is incredibly elegant. Marine DNA, particularly from salmonid species, just happens to be highly biocompatible with human tissue.
But isn't there a huge risk of allergic reaction? I mean, introducing animal DNA into a human body just sounds risky.
You'd think so, but that is the beauty of the purification process. The manufacturing process strips away all the proteins, all the lipids, and any active immune-triggering compounds.
Oh, so it's not like raw DNA.
No, not at all. What you are left with isn't functioning fish DNA. It is just the pure fundamental building blocks of nucleic acids.
Yeah.
The raw alphabet of life, essentially.
Okay, that makes more sense.
Right. And because it lacks those proteins, the human body doesn't recognize it as a foreign invader. It just sees this massive delivery of raw building materials.
Okay, so we have these purified nucleic acid building blocks. How do they actually communicate with a human cell to help it heal?
Our sources break this down into a really fascinating dual action. First, these polynucleotides actively seek out and bind to specific receptors on the surface of our cells called CD44 receptors.
Wait, what does a CD44 receptor actually do?
Think of it as the ignition switch for the fibroblasts.
Okay.
When the polynucleotide fragments dock with a CD44 receptor, it flips that switch, turning on the fibroblast and really supercharging its ability to synthesize new collagen.
Oh, wow.
But not just any collagen. Specifically type I and type 3 collagen, which are the exact types that give youthful tissue its strength and elasticity.
So they're actively telling the cellular factory to, like, speed up production.
Exactly. And that is just the active stimulation side of the equation.
There's more.
Oh, yeah. The second part of their dual action is arguably even more important, especially in the context of the thermal heat we just discussed. Polynucleotides are powerfully hydrophilic.
Meaning they attract water. Right.
When they're introduced to the tissue, they instantly form this three-dimensional water-binding gel matrix.
A gel matrix.
Yeah, they act like a microscopic sponge, drawing in and holding moisture, which provides intense, deep tissue hydration from the inside out.
That sounds incredibly soothing after, heat treatment.
It is. But the most crucial element here involves their interaction with another set of cellular antennas called A2A adenosine receptors.
Okay, another receptor. What is the A2A receptor doing?
When polynucleotides stimulate these A2A receptors,
Yeah.
it triggers a potent anti-inflammatory pathway. It actively downregulates the production of pro-inflammatory cytokines.
Cytokines, those are like the alarm bells, right?
Exactly. Cytokines are basically the chemical alarm bells that the body releases when it's injured. And they're what actually cause the swelling, the redness, and the pain. So the polynucleotides literally tell the body to stop ringing the alarm bells.
I see. So earlier I used the analogy of RF microneedling being like aerating a lawn, but that feels, I don't know, a bit too simple now.
It's a bit more intense than that, yeah.
Right. It's more like if the RF microneedling is setting a controlled fire in a building to clear out the old sluggish structure,
Okay.
then the polynucleotides are like turning off the chemical fire sprinklers once the fire is out. You stop the flooding, you stop the inflammatory damage, so the cellular construction crew can actually start rebuilding in a clean, highly hydrated environment without getting, completely soaked.
That is a brilliant way to visualize it. You are providing the exact biochemical environment the cells need to recover from the stress test you just put them through.
Okay, so if the tissue is completely inflamed from the heat of the RF needles, doesn't pouring a serum or injecting a gel into it just irritate it more? I mean, how do these two therapies actually mix in a clinical setting? Because the core question of this deep dive is whether these can be used together on the same delicate tissue.
Right. And the direct answer from our stack of clinical sources is a resounding yes.
Okay.
Polynucleotides are not just safe to use on vulvar skin that has undergone RF microneedling. They are highly recommended as a synergistic combination.
Synergy is one of those words that gets thrown around a lot. How exactly do they enhance each other here?
Well, if we connect this to the bigger picture, we are looking at a concept in regenerative medicine known as stacking or layering treatments.
Right.
For a long time, the medical approach was very singular. You have a symptom, you apply a single treatment. But stacking acknowledges that tissue degeneration happens on multiple levels.
It's more complex.
Exactly. You have to provide both the mechanical stimulus to repair, the RF microneedling, and the optimal biological conditions to actually execute that repair, the polynucleotides.
And mechanically, they complement each other perfectly, right? Think about those thousands of tiny microchannels we just punched into the skin with the RF device.
Yeah.
They don't just heal over instantly. They remain open for a short window, acting as perfect direct delivery pathways.
Exactly. When a polynucleotide serum is applied right after the needling, it doesn't just sit uselessly on the surface of the mucosa.
Right.
It travels down those tiny physical channels, penetrating deeply into the exact dermal layers that need the fuel the most.
And this is where the recovery benefits become undeniable, because we know polynucleotides have those strong anti-inflammatory properties via those A2A receptors. Introducing them immediately after the thermal trauma significantly blunts the negative side effect.
It does. It makes a huge difference for the patient.
It visibly reduces the post-procedure redness, the swelling, and just the overall patient downtime. The tissue transitions from a state of acute distress to a state of active, supported repair much faster than it would on its own.
Yes, exactly.
But it's not just about bouncing back quicker, right? Our sources suggest it's about a superior final result.
Absolutely. The heat from the RF initiated the collagen production, but the PNs provide the sustained cellular signaling to keep that production going long after the treatment is over.
Wow.
The outcome is a much more robust, durable remodeling of the vulvar tissue.
So what does this all mean for the patient's schedule? Are these done on the exact same day in the clinic?
The clinical consensus shows there is some flexibility, and it really depends on the specific patient's needs.
Okay.
But in many cases, yes, they are done on the exact same day. The PNs can be applied topically to help the RF device glide smoothly, which actually drives the product down into the microchannels during the procedure.
Oh, that's clever.
Right. Alternatively, PNs can be injected deep into the tissue a few weeks before the RF treatment to sort of prime the cellular environment.
Priming the tissue, meaning you are basically feeding the fibroblasts for a month so they are strong and ready before you hit them with the thermal stress test.
Precisely. You make the cells more robust and responsive to the upcoming thermal injury.
Make them stronger going into it.
Exactly. And then they are often injected post-treatment to actively accelerate that recovery phase we talked about.
Got it.
The timeline is highly customizable by the provider, but the biological partnership remains incredibly consistent.
Okay, the cellular biology is wild, and the mechanisms make total sense. But we need to move beyond the microscope and ground this in why it actually matters for the person experiencing it.
Yeah, the real-world impact.
Right. We need to understand why this specific combination of treatments is fundamentally changing the quality of life for women. Our sources focus heavily on genitourinary syndrome of menopause, or GSM, and vulvovaginal atrophy, VVA.
These are clinical umbrella terms for a reality that is staggering in its prevalence.
It really is.
The data from our sources indicates that over 50% of postmenopausal women suffer from the symptoms of GSM and VVA within just 4 to 5 years of menopause.
Over half. I mean, that is millions upon millions of women.
It is.
And the symptoms aren't just minor inconveniences, they are severe. As systemic estrogen levels drop off during menopause, the local tissue literally starves.
What's a good way to describe it? Yeah.
We are talking about chronic vaginal dryness. We are talking about profound tissue fragility, where the mucosa loses its stretch and tears easily, persistent itching, chronic infections, and dyspareunia, which is the medical term for painful intercourse.
Right.
It is a progressive, relentless deterioration of the tissue's structural integrity.
And this raises an important question about the historical context of women's healthcare, which our sources do touch on.
Oh, absolutely.
Because for generations, the medical community largely dismissed these severe issues. The loss of intimacy, the chronic pain just walking or wearing jeans, it was often brushed off as just a normal part of aging.
Right, like just deal with it.
Exactly. Women were essentially handed over-the-counter lubricants and told to simply endure it.
It is a massive historical blind spot. It represents a total failure to prioritize women's quality of life, especially when we now have regenerative tools that don't just temporarily mask the dryness or the discomfort, but actively attempt to restore the tissue's fundamental function.
And that leads to perhaps the most vital point in this entire deep dive. The fact that this combination, RF microneedling stacked with polynucleotides, is completely non-hormonal.
That is a massive breakthrough because for decades, the absolute gold standard treatment for VVA has been localized estrogen creams or inserts.
Right.
And while those work brilliantly for many women, a huge population of women simply cannot use them. Think about breast cancer survivors, particularly those with estrogen receptor-positive cancers.
Yes, that's a huge group.
They are thrust into medically induced sudden menopause by their treatments, and they cannot safely use hormonal therapies because it could feed a recurrence of the cancer.
Exactly. Or women with a history of severe blood clots, or those who simply do not tolerate the systemic side effects of hormone replacement therapy. For years, these patients have been left with almost no viable medical options to treat their localized pain and atrophy, until these regenerative therapies emerged.
I noticed our sources cited clinical outcomes tracked using something called the payer scale, the personal assessment of intimacy in relationships.
Yeah.
Obviously, clinical scales can sound a bit dry, but what does a significant improvement on the payer scale actually mean for a woman living with these conditions?
It means a return to normalcy. The pair scale measures everything from physical comfort to emotional closeness with a partner.
Okay.
And when these non-hormonal regenerative treatments are tracked, the studies show highly significant improvements. Women are reporting a return of natural, unprompted lubrication. They are reporting a complete cessation of pain during intimacy.
That's life-changing.
It is. But even beyond intimacy, it is a profound improvement in just daily physical comfort, just the ability to sit, exercise, or go about their day without chronic irritation.
It is incredibly empowering. Restoring elasticity and daily comfort to the vulvovaginal area isn't about vanity or some abstract pursuit of aesthetic perfection.
Not at all.
It is about reclaiming ownership of your own body. It is about taking back your quality of life, your sexual health, and your basic physical confidence without having to rely on systemic hormones or undergo invasive surgeries.
It perfectly encapsulates the modern shift from palliative care, where you are just trying to soothe the symptom temporarily, to true regenerative medicine.
Right.
We are actively attempting to reprogram the local tissue to behave, structure itself, and hydrate itself the way it did years prior.
Well, let's summarize the incredible ground we've covered today. When it comes to treating vulvovaginal atrophy and the structural symptoms of menopause, Layering these two specific treatments is proving to be a clinical powerhouse.
Absolutely.
Fractional RF microneedling provides the mechanical blueprint. It uses insulated needles and targeted radio waves to create microinjuries and denature sluggish collagen, forcing the tissue to wake up and remodel a tighter, more vascular foundation.
And then the polynucleotides, those highly purified marine DNA fragments we talked about.
The fish DNA, right?
Right. They step in to deliver the biological building blocks. They bind to specific cellular receptors to flip the switch on collagen production. They act as a sponge to intensely hydrate the tissue, and they turn off the chemical alarm bells to soothe the inflammation caused by the RF heat.
For you listening, it is crucial to recognize that this represents a massive paradigm shift in modern medicine.
It really does.
We are steadily moving away from the era of merely managing decay with daily creams or relying solely on introducing exogenous hormones. Instead, we are entering an era of regenerative therapies.
Yeah.
We're finally learning how to speak the language of the cells, providing the body with the exact mechanical signals and biological raw materials it needs to heal itself.
It is about fundamentally changing the cellular environment rather than just treating the surface symptoms.
Which leaves you with one final incredible thought to ponder. If we can take purified marine DNA fragments and targeted radio waves and use them to successfully reverse chronic tissue atrophy and inflammation in some of the most delicate, sensitive, and historically overlooked tissue in the human body, what other age-related degenerative diseases throughout the rest of the body might soon be reversed? If we can literally reprogram the healing environment of the cells here, what stops us from applying this exact same biological logic to degenerating joints in an aging athlete, failing organs, or chronic inflammatory skin diseases?
The potential applications are practically limitless once you understand how to sequence that cellular repair.
So it turns out that the center of that Venn diagram, where marine biology, radio waves, and women's intimate health overlap, isn't empty at all. It might just be the blueprint for the entire future of healing.